Assalamu alaikum and a very good day to everyone that is watching this video. In this video, we are from Bachelor of Dietetics with honors. We'll be presenting on diabetes among adults. Have you ever wondered why wherever you go everyone will be talking about diabetes, especially among adults? For example, like, do you know someone is in the hospital for diabetes? Or don't drink too much sugar, you'll get diabetes. To think about it again, do you actually truly understand what is diabetes? Diabetes is actually a chronic disease that is due to high sugar level in our bloodstream. As we know, the food that we eat will break down into sugar to provide energy to our body. For it to function properly, insulin is needed to use the glucose to turn it into energy. Without it, it is what causes the high blood sugar level in our bloodstreams. There are three types of diabetes. First, let's look into the first type. The first one is type 1 diabetes. Type 1 diabetes is caused by an autoimmune reaction where the body's defense system attacks the cells that produce insulin. They need daily injection of insulin to regulate their blood sugar level. Type 1 diabetes may be caused by genes, environmental factors such as viruses that might trigger the disease. Next is the type 2 diabetes. This type of diabetes is due to insulin resistance, where the body does not fully respond to insulin. Insulin cannot work properly and causes the blood sugar to keep rising. To compare it with type 1 diabetes, type 2 diabetes is often milder than type 1, but it can still cause major complication. Type 2 also raises your risk of heart disease and stroke. Lastly is the gestational diabetes mellitus, or known as GDM. This is a terrifying threat to maternal and child health. The prevalence of high blood sugar like hyperglycemia in pregnancy increases rapidly with age. Exposure to hyperglycemia in womb exposes children to a high risk of becoming overweight or obese associated with development of type 2 diabetes. The cause of GDM is during pregnancy, your placenta makes hormones that cause glucose to build up in your blood. Usually, your pancreas can send out enough insulin to handle, but if your body cannot make enough insulin or stops using insulin as it should, your blood sugar level will rise and you get gestational diabetes mellitus.
Now, let's take a look at the treatment that we can provide for each type of diabetes. Type 1 diabetes. As we know that all people with type 1 diabetes got to take insulin to regulate their blood sugar levels. There are different types of insulin that depending on how quickly it works and how long it can last. The first one is rapid-acting insulins, where this should be taken before or with a meal. These insulins act very quickly to limit the increase in blood glucose. Next is short-acting insulin that should be taken before meals and do not act as quickly as rapid-acting insulin and may be appropriate for certain people only. And the third one is intermediate-acting insulins. These should be taken together with short-acting insulin. Intermediate-acting insulin will start to act within the primary hour of injecting, followed by a period of peak activity lasting up to 7 hours. And the last one is long-acting insulins. This type can last in the body for up to 24 hours. This insulin should be taken in the morning or the evening right before going to the bed. Other than that, there are two common insulin treatment plans, which are twice daily insulin and a basal bolus regimen. Now, let's move on to the treatment for type 2 diabetes. Usually, type 2 diabetes is to having a healthy lifestyle that includes a healthy diet, regular physical activity, not smoking, and maintaining a healthy body weight. Over time, a healthy lifestyle is not enough to stay blood sugar levels, and it might need to have an oral medication. And the most common one for users of oral medication are metformin and sulfonylureas. The last one is the treatment for gestational diabetes mellitus. Firstly, we should monitor the blood glucose level several times each day. And secondly, the patient of this diabetes should meet with a registered dietitian to get a review for healthy food option. And the last one is they should try to keep a food log and always get moving to lower their glucose levels. And now let's move on to the causes and symptoms of diabetes. The causes of type 1 diabetes are still unknown, but commonly it happens when our immune system that normally fight for harmful bacteria or viruses attacks and destroys the insulin producing cell in the pancreas. For type 2 diabetes, the causes happen when our cells become resistant to the action of insulin and our pancreas is unable to make enough insulin to overcome this resistance. Other factors of being overweight also one of the causes of type 2 diabetes, but for sure not everyone with type 2 diabetes overweight. Lastly, for gestational diabetes that happens during pregnancy, the placenta that produces hormones to sustain the pregnancy makes our cells more resistant to insulin. And not to forget to mention that there were a lot of symptoms that lead to diabetes. The symptoms are urination a lot, often at night, and then always thirsty, hungry, have more infection than usual, have a blurry vision, feel very tired, have numb or tingling hand or feet, and have a dry skin. Also, have a sore that heals slowly.
Next, how we can prevent ourselves from not getting or low risk for having diabetes. For the type 1 diabetes, there is no effective intervention presently available to prevent this type of diabetes, even though a huge wide variety of clinical trials aim toward halting the ongoing autoimmune destruction of pancreatic beta cells. However, there may be little evidence that obesity and an excessively growth rate in children are vulnerable risk factors, indicating that a healthy way of life that avoids overeating and a sedentary lifestyle is recommended for high-risk groups such as the siblings of children with type 1 diabetes. This consists of not being breastfed, being the firstborn, being born with the aid of using cesarean section, and having an older or overweight mother. Although a cure for type 1 diabetes is being actively sought, stopping or delaying it in those known to be at risk or in those already diagnosed, slowing down the autoimmune destruction of beta cells and protect those cells which can be active are likely to be more manageable goals in the foreseeable neither has been convincingly accomplished as yet. However, numerous research is underway using interventions along with oral insulin in humans known to have markers of islet autoimmunity, trialing tablets already used as an instant in psoriasis to prolong beta cells life, and using peptide immunotherapies to retrieve killer T cells, the lymphocyte which can be closely involved in the underlying mechanism of type 1 diabetes. For type 2 diabetes, especially for overweight, there are some steps for preventing the diabetes due to lifestyle, such as we can cut calories, replacing saturated fats with unsaturated fats, and do not forget consume dietary fiber like fruit, vegetable, and whole grains. And lastly, avoid cigarettes, excessive alcohol, and sugar added in our food. And the important thing is to engage in regular physical activity in order to keep blood glucose levels under control. It is more successful as it incorporates a mix of aerobic, such as jogging, swimming, cycling, as well as we can reduce spending an active lifestyle. Lastly, for preventing the gestational diabetes mellitus, we can maintain a balanced diet, like consume a well-balanced diet rich in fruits and vegetables, limit fat intake, especially saturated and trans fat intake, avoid sugar added too much, and processing food. The mother also need to take high fiber and keep portion in check. Keep an eye on the number of the scale. Try to maintain a normal weight and BMI with the aid of your practitioner. This involves gaining the right amount of weight during pregnancy and losing the extra pounds afterward. I strongly believe that prevention is better than cure. That's all for us. Thank you for hearing out and give all your attention to this presentation. We hardly believe that all you understand the meaning behind this presentation. Let's stay healthy and stay safe. Thank you.